Now, here at home, around 10,000 people die each year from cardiovascular disease, but research shows that patients who take part in cardiac rehabilitation can prolong their lives and have a better quality of life. A new campaign has now been launched with the aim of getting more people involved in cardiac rehabilitation. And here to tell me more about it is Mary Keirns, a nurse and coordinator of cardiac rehabilitation in St James's Hospital, Cradock, a physiotherapist in St Vincent's Hospital, and John Crean, a cardiac patient. You're all very welcome to the programme this morning. Mary, if I can start with you first of all, what is cardiac rehabilitation?
Okay, cardiac rehab is about getting a person back to their best possible state of health after they've had a cardiac event. So I'm talking about after a coronary artery bypass graft, after having a heart attack, after having angioplasty and stenting, after valve surgery, or if they have heart failure. So we do that by getting them to do physical exercise and also by a programme of education, so it's combined.
So it's not just an exercise
No, it's
programme.
not just exercise, it's a package really. There are programmes all around the country, so every hospital that has a coronary care unit has a cardiac rehab attached to it, and it's part of the patient's treatment. They're usually referred by their cardiologist or by their nurse or by their the healthcare worker, but if they haven't been, then they should look actually and ask to be referred. And
there are a number of phases in cardiac rehabilitation. What are the 4 phases?
Well, first of all, we talk about phase 1, and can I just say first of all that cardiac rehab is it's a team effort, so it's multidisciplinary in its approach, meaning that all the experts come to give their advice. So you have doctors, nurse specialists, physiotherapists, social workers, pharmacists, all coming in to give the expert advice. So phase 1 is actually in hospital, so it's immediately after the person has the cardiac event, be it the heart attack or whatever. And that usually myself or one of my colleagues would come and visit the person in the bedside. We'll give them advice on going home, because they can be quite vulnerable and can be quite shocked really. So it's there as a support as well. And we will introduce then the other phases and introduce the programme and recruit them for a programme. Phase 2 then is the immediate aftercare. So it's the time from when they go home. It's usually about 2 to 6 weeks. It's the interim period between being hospitalised and then coming on a structured programme. And that's the time that people are most vulnerable. So, we have a support there whereby we would either ring them to see how they're getting on, phone call, or we might invite them into a one-to-one appointment with the cardiac rehab coordinator, or there might be a group session where they would all come in together. And then we would recruit them and for the phase 3, which is a structured programme. And in that then, the structured programme phase 3 is the programme of exercise and education. It usually lasts for about between 6 to maybe 10 weeks, depending on the centre. It means going in for 2 to 3 times a week. It incorporates exercise and education. Now, the exercise then would be in a gym, usually. It is a circuit, check their blood pressure, the heart rate.
Particular kind of exercises and education on that. And then phase 4 then is the maintenance side.
Phase 4 is the maintenance side.
Now, John, if I can turn to you next, because you have had a heart attack, but you've also had aortic valve surgery and you've had stents put in as well. You've availed of cardiac rehabilitation. What kind of a difference has it made to you?
Well, I had my heart attack in 1998 and I did the cardiac rehab at that stage. And then 2006 I had the aortic valve replacement. And after that I kind of struggled a good bit with symptoms and so on. And it was really in 2011 when I did the cardiac rehab course then that I discovered about the stage 4, which is the ongoing. And I haven't been hospitalised since, and I've been attending the exercise class for twice a week for about 3 years, and I feel great benefit from it,
And is it just exercise that you do, or is it a chance to meet others who are in similar situations?
Yeah, it's also meeting people in a similar situation in the group, and there's good banter and crack in the group, I think what was happening to me before was that I was just walking and concentrating on walking and diet, whereas the constant going to the exercise, like there's weights and there's bicycles and rowing machines and all sorts of different things, like you go around a circuit, a few minutes on each. step-ups and so on. And it's just that mixture that it really helps, because like your heart is a muscle, and it benefits from raising your heart rate, you know.
And Karen, from the physiotherapy point of view, I mean, what kind of a benefit does this kind of a coordinated approach have for patients?
Well, I suppose that it's specific to when Mary works through the phase 3 programmes, when we're going through education and risk factor modification, we'd continue that work, but we'd work specifically on exercise training. So that would really be trying to make your body work more efficiently, so you're offloading the work of the heart, and you'd slow down the progression of the heart disease, the plaque formation on the sides of the arteries. But also, as John was alluding to, it's a big group session. People are getting a lot of support from each other, and certainly the discipline of coming to a phase 4 programme for the rest of your life as a maintenance programme, including a walking programme maybe with that, is very important for people to maintain what they've achieved in phase 3.
And as John was saying, that he hasn't been hospitalised since beginning on this phase 4, this maintenance programme. I mean, obviously there are benefits that people can get from this. Absolutely.
So you're starting to reduce your blood pressure, your heart rate further, looking at your risk modification a little bit more, starting to reduce your cholesterol also with the exercise. So basically everything is working more efficiently. You're offloading the heart, you're reducing your risk of more cardiac events, so you're reducing your risk of hospitalisation. The other thing that happens is we kind of promote people to self-manage. So if there is a change in symptoms, that they would go back to their GP or their cardiologist as appropriate. So people are managing themselves a little bit better, and they have that discipline of coming to a programme once or twice a week, whichever suits. Yeah.
And Mary, you say this is something that is available nationwide?
This is available nationwide, yes, and it is free, and it is part of the patient's treatment. You know, a lot of people maybe find that they can't take it up due to a lot of barriers, I suppose, maybe work or maybe finance, but it is free, and a lot of workplaces actually allow people to do it while they are back to work. So it's very positive, it's very beneficial. You know, the quality of life is, as we said, certainly is improved, and it gives people a support and motivation, and that's what it's all about, really.
And a chance to meet, as you were saying.
Yeah,
Mary Keirns, John Crean and Karen Cradock, thank you all three of you for coming in this morning.